Have you ever wondered what causes cancer, a disease that affects millions of people around the globe? Today, we delve into this intricate subject, unraveling the causes, types, and treatments of cancer. Cancer is a complex group of diseases characterized by the uncontrollable growth and spread of abnormal cells in the body. It can occur virtually anywhere in the body. Cancer's causes can be categorized into 5 main groups. First, we have hereditary factors. Some inherited genetic mutations can predispose individuals to cancer. Secondly, exposure to carcinogens in the environment significantly increases the risk of developing cancer. Carcinogens include tobacco smoke, asbestos, ultraviolet radiation from the sun, and certain chemicals. Thirdly, unhealthy lifestyle habits such as smoking, excessive alcohol consumption, high intake of processed foods, lack of fruits and vegetables, physical inactivity, and obesity can contribute to the development of cancer. Fourthly, certain viruses like human papillomavirus, hepatitis B and C virus, and Epstein-Barr virus are associated with certain types of cancer. These viruses can integrate their genetic material into the host's DNA. Lastly, the risk of developing cancer increases with age. There are numerous types of cancer. Breast cancer, which occurs in breast tissue, is the most common cancer among women worldwide. Lung cancer, primarily caused by smoking and secondhand smoke exposure, is the leading cause of cancer-related deaths globally. Colorectal cancer affects the colon or rectum and is commonly associated with dietary factors, physical inactivity, and obesity. Prostate cancer, which occurs in the prostate gland, is the most common cancer among elderly men. Skin cancer primarily occurs due to exposure to ultraviolet radiation from the sun or artificial sources like tanning beds. Preventing cancer involves reducing exposure to risk factors and adopting healthy lifestyle habits. This includes tobacco control, eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, regular physical activity, limiting alcohol consumption, sun protection, vaccination against certain viruses, and early detection through regular cancer screenings. The treatment of cancer depends on various factors, including the type and stage of cancer, the patient's overall health, and their preferences.
Have you ever wondered about the common misconceptions surrounding cancer treatments? There's a lot of misinformation out there, and today we're going to delve into the facts. Firstly, let's talk about surgery. This is often the primary treatment for cancer, involving the surgical removal of cancerous cells. It aims to prevent the spread of these cells to other parts of the body. Next is chemotherapy. This treatment can kill cancer cells or inhibit their growth and division. It's a powerful tool in the fight against cancer, but it's not without its side effects, which can range from fatigue to hair loss. Then there's radiotherapy. This treatment uses waves of energy to destroy cancer cells. It's a targeted approach that focuses on the area where the cancer is present, minimizing damage to healthy cells. Immune therapy or immunotherapy is another type of treatment. This stimulates the body's immune system to fight against cancer. It's like giving your body's natural defenses an extra boost to tackle the disease. Targeted therapy involves the use of drugs. These drugs can either inhibit the growth of cancer or directly destroy it. It's an approach that targets cancer cells specifically, leaving healthy cells largely unharmed. For cancers that are hormone-related, such as breast and prostate cancer, hormone therapy can be used. This therapy can block the production or action of hormones that promote the growth of cancer. Finally, there's bone marrow transplantation, which can be recommended for certain cancers, especially blood cancers. In this process, unhealthy bone marrow is replaced with healthy stem cells, paving the way for the growth of new, healthy cells. Remember, treatment is personalized in every cancer case and depends on various factors like the type, location, and stage of cancer. Always consult with a doctor for personal treatment plans. As we've discussed, there's a variety of cancer treatments available, each with its own pros and cons. Surgery aims to physically remove cancer. Chemotherapy uses powerful drugs to kill or slow the growth of cancer cells. And radiotherapy uses energy waves to target and destroy cancer cells. Immunotherapy boosts the body's natural defenses, while targeted therapy uses drugs to specifically target cancer cells. Hormone therapy is used for hormone-related cancers, and bone marrow transplantation is often used for blood cancers. It's important to remember that the choice of treatment depends on the individual's specific situation. What works best will depend on the type and stage of cancer, the patient's overall health, and their personal preferences. It's always best to discuss these options in detail with your healthcare provider. Remember, knowledge is power. Understanding the different types of cancer treatments can help dispel common misconceptions and empower individuals to make informed decisions about their health. So, let's continue to spread awareness and fight the good fight against cancer.
Forget the role of nutrition in preventing and battling cancer. Certain foods are believed to contain cancer-fighting properties due to their high content of antioxidants, vitamins, minerals, and other beneficial compounds. Including these substances in a clean diet can potentially reduce the risk of certain types of cancer. Examples of these foods include fruits and vegetables, whole grains, legumes, seeds, green tea, and certain herbs and spices. Remember, each cancer case requires personalized treatment, and the choice of treatment depends on various factors such as the type, location, and stage of cancer. Always consult with a doctor for a personalized treatment plan. In conclusion, there are several methods to treat cancer, each with its strengths and weaknesses. The key is to find the best approach for each individual case, taking into account the type of cancer, the patient's overall health, and their personal preferences. While the battle against cancer is challenging, these treatments offer hope to countless patients around the world.